Paul recently lost his job. He has been weeping and wailing. His family depends on his paycheck. The only source of income that he thinks might become available is a life insurance policy. Paul has tried to do as many jobs as possible. He started driving an Uber, delivering pizzas, and picking up any job that he could through the local community center. But Paul is struggling. All the income he has gathered together has still been insufficient. His body feels tired and his mind feels weak. He shared his concerns with a friend recently who said, "You're a man, be a man." Today, we're going to be talking about Movember. As I'm sure you know, Movember is the term given to the month of November, which is dedicated to the well-being of men all around the world. The Movember Institute of Men's Health brings together world-leading experts in men's health with one mission: to translate everything they find in terms of research into improving the well-being of men all around the world. Movember is really both local and global. There's a lot of investing in healthcare and collaboration on important issues that change and move the needle when it comes to men's health on a worldwide basis. Today, I'm going to be talking to you about really important things relating to men's health that can sometimes be ignored. I'm going to start with mental health. A few important facts about mental health. The first thing is that more men die due to suicide than any other reason when they're under 50. 3 in 4 of all suicides are male. Men are 3 times more likely to die by suicide than in a vehicle accident or collision. There are many facts and factors that potentially could contribute to this topic. However, there are many causes or triggers or potential reasons why these numbers might be the case. A lot of research suggests that, similar to Paul, suicide can be seen as a solution to life events that many men can no longer solve. Some of these factors are things like emotional factors, where there is significant relationship breakdown, financial concerns, work concerns, housing concerns as well. Other concerns that seem wider but still have the ability to cause an existential crisis include the sense of failure as a man, loss of feeling of purpose, a significant feeling of loneliness and isolation, loss of occupation, or a greater meaning in the world. This feeling of failure as a man is important to talk about, especially when society has defined a man in certain situations as someone who ought to fix everything, or as someone who is not entitled to have his own emotion. So suicide rates for men, in men, is very high. There are a few things that we can do when we are worried about a man, especially when it comes to his mental health. The first is noticing a change in his sleeping habits, noticing a change in his reactions, whether he's becoming more irritable than usual or less engaging. avoidance of social interactions and sporting events, eating less or more than usual. Other things including avoiding the daily tasks and habits that are routine parts of taking care of oneself, but also people speaking with final kind of words. So talking about dying, talking about death, talking about ending it all and not wanting to be here anymore can be red flags that might indicate that there is something that is going on. So there are lots of different things that we can do to try to assess if someone needs help. Also, it's also a way to encourage someone to take action, but also a way to affirm that you are listening to them when they feel they might not have access to a listening ear. Movember has come up with the term ALEC as a tool to help your friends. A is for ask. Ask about how they're feeling. Trust your instinct and see how they respond. I normally say when someone says I'm fine, ask again. I'm fine tends to be a knee-jerk reaction, so always ask again. L is for listen. Give them your undivided attention. Make eye contact. Don't say anything, just give them what we call a golden minute to speak as freely and as openly as they want to. E means encourage action. Help them to focus on what it is that they can do now that can help them feel better. And C, check in. Always check in. Add a tab on your calendar to check in. This is so important. Develop a habit of adding people to your calendar. A check-in with Mary on Monday, a check-in with Philip on Tuesday, a check-in with Paul on Wednesday. Those little check-ins make a world of difference. And yes, our world gets really busy, but you can add a little reminder to your calendar, an alarm to your phone, and just send a check-in message or a 5-minute phone call. You never know. You might be pulling someone out of a ditch. You might be saving someone's life. Movember also celebrates other aspects of men's health, including raising awareness of prostate cancer. As we've discussed previously on the podcast, prostate cancer is an increasingly common cancer among men above the age of 45. And there's a few things that you can do. The most important is getting early detection. So if there's a family history, if you're a man from a Black family origin or with African ancestry, really important to speak to your doctor about screening, testing, and checking something called the PSA. Also, if you're increasing in age and you're above the age of 45 or 50, definitely also talk to your doctor about your risk. Something as simple as a conversation with your doctor can give you a lot of information that you need and bring you to a place where early detection can save your life. So in this month of November, I want you to do one thing. I want you to check in on one man and just give him the opportunity to say whatever is on his mind. And if he doesn't want to talk about emotions or feelings, why don't you raise a question and say, what do you think about Movember? What do you think about what it is that they are doing? And see what he says. Start a conversation and improve the life of one person day by day.